During this episode of Making the Rounds, we are discussing advancing treatments in orthopedics and sports medicine. To learn more about this topic or other orthopedic-related services provided at Banner Health, please visit bannerhealth.com/orthopedics. Making the Rounds dives into medical topics with those who know them best, healthcare providers. My name is Bridget, and I'll be your host for today's episode. If you're new to our podcast, thank you for tuning in. And if you're a regular listener, welcome back. Joining me today on Making the Rounds is Dr. Grant Padley, an orthopedic surgeon, sports medicine physician at TOCA Banner Health here in Phoenix, Arizona. And Dr. Padley is also one of the team physician orthopedic surgeon for the Cincinnati Reds major and minor league baseball team. So we're here today on site with Dr. Padley. Thank you so much for joining us today.
Yeah. Thank you for coming out and joining us on our first report day of spring training. It's very exciting.
This is so exciting. So if you're just listening to this podcast, hopefully you can go to our YouTube site or our Spotify account and you can take a look at our on-site location. This is our first on-site location for a podcast.
Perfect place.
Yeah, it is. Super exciting. So Dr. Padley, thank you again for joining us today on Making the Rounds. Tell us a little bit about yourself and why we're out here today.
You bet. Yeah. So as she said, Grant Padley. I'm an orthopedic surgeon specializing in sports medicine. I've been in the Phoenix area for 16 years now. I came here out of fellowship from Houston, Texas. And have had the privilege of this being my 16th season as well with the Cincinnati Reds, helping them during spring training and throughout the year with their minor league and rookie affiliates that come here for injuries and rehab. And it's been a great opportunity for me through these years to have this ability to still be in area where I can take care of athletes at a high level.
So as we shared, you're not only the physician with TOCA Banner Health, you're one of the you're one of the physicians for the major league, minor league baseball team here. And as we're on site in Goodyear at the training facility, can you share, what are we doing here today as you're gearing up for spring training?
Today we have a report day for major league pitchers and catchers where we go through their physicals, and all players get the entire physical from head to toe, lab work, EKG, orthopedic exam, medical exam, to make sure that they're ready to go for spring training. Eventually we'll have about 170 players down here, all vying for that 26-man roster spot.
So when we're talking about the physicals, the workups, tell us a little bit about some of the details, some of the complexities that go into this.
Yeah, I mean, they do get a head-to-toe physical. Obviously, a lot of these guys are they're a big investment for the team and for the ownership to be able to participate and play to the highest of their level. And so they'll get the entire head-to-toe physical, looking at all their joints. We'll get MRIs and X-rays, especially on pitchers and throwers. They all get MRIs and imaging of their shoulders and elbow, at least to get a baseline if we don't already have them, but also to evaluate to make sure there's nothing chronic or acute, something that might be getting ready to kick off that we could try to stop and prevent injury.
Can you tell us a little bit about when we're looking at these professional athletes or your collegiate athletes, your high school athletes that are on the field every single day, how did their injuries differ from the general population?
Well, you can of course have an acute injury. One specific episode occurs and you get an acute injury. Commonly we hear about that or see that in our pitchers. Very common with the Tommy John injury, the ulnar collateral ligament of the elbow. But we can also get a lot of overuse injuries. And so those are monitored throughout the season to look at players. They have amazing amount of statistics on players on what they can or can't do, how much they've thrown, how many innings they played. There's tracking on their heart rates. And so it's very scientific on all the players as far as tracking them. And so we look at that. And so obviously in our average population, our weekend warriors, our pickleballers, we don't have those statistics. We can't try to predict a potential injury or learn to shut someone down before the injury occurs. But the injuries are still very similar as far as the overuse aspect of it.
So when we're thinking of these athletes and we're talking about these innovations in surgical techniques, the rehab component that comes with this treatment as well, if I threw my shoulder out and needed rotator cuff repair, I would probably not be able to reach over my head, and I would think that my recovery time would take so much longer. But you have pitchers, you have your catchers, you have all of these professional athletes that throw their shoulder out, get major surgical intervention, and they're back out on the field.
Yes, I mean, there is a little difference there as well, because our typical surgical patient in the clinic, we will send for physical therapy, and they're usually 2 to 3 times a week, whereas when you're in this setting, you're going to have someone working with you every day. I mean, biology still has to take hold, and it still has to heal. Obviously, the younger you are, the better your biology is typically for healing potential. But so they do get a little bit more care daily, but there's still pretty set timelines, as far as returning back to their activity, depending on what the injury was, what the surgery was. And those we do carry over into our general population as well.
For those professional collegiate teams, you guys have a different, tools in your tool belt when it comes to the rehab, when it comes to the repetition. You guys are seeing these types of injuries all the time, and you can take that, what you have here on the field, and you can bring that into your clinical practice. How has that helped your patient?
So yes, I mean, we do have a little bit of benefit with having somewhat cutting edge technology and seeing the latest as far as rehabilitation, the new things that are coming out. Sometimes those don't pan out. Sometimes those become mainstream. And so we can implement those with our average population as well, and our weekend warriors, or the person that has a simple fall and injures their shoulder. So they can feel good with all of the orthopedic surgeons at Banner, that they're taking what they're learning here, whether it's professional, collegiate, high school, and using it in the general population as well, including all the way down to the rehab level, because we do have a fair amount of rehab physical therapists, athletic trainers that have worked in some degree of professional baseball, minor league baseball, collegiate, that are now working with us in the Banner clinics.
So when you're talking about the rehabilitation or some of the advancements, can you walk us through what are some of the advancements that you're currently using, whether it's biologics or we had an interview with one of our sports medicine non-operative physicians not too long ago, and she was sharing with us some of the treatments that they provide on chronic tendinitis.
Yes.
Do you incorporate some of those non-operative therapies into your practice?
Oh yes, yeah, those have been very helpful, because someone in that situation, when she was speaking about the TENJET or different things, those are sometimes hard for us to solve, like a tendinopathy issue or with a surgical fix. So the fact that they have these other modalities have been fantastic for us, including other procedures such as something as specific as calcific tendinitis in the shoulder. If that would fail conservative treatment, to go on to something surgical, which is a big ordeal with general anesthesia and rehab, whereas now they can do things such as those type of procedures to alleviate that problem without someone undergoing general anesthesia. So we do utilize that a fair amount, including biologics such as PRP injections. We have lengthy discussions with patients. Obviously, they can Dr. Google all they want and see these other biologic options. And we discuss that, with the patient. Yes, that would be a good option for you. No, that wouldn't be a good option for you, and this is why. And into the rehabilitation side of things, including blood flow restriction, which we've been using for many, many years. It's now getting into the general clinics as well and been very beneficial for quicker rehabilitation and the different things that we've learned here, or the physical therapists or trainers have learned here, that they're able to now use in our general clinics as well.
So let's shift a little bit on rehabilitation, because this is huge for the population that is behind us right now.
Correct.
Rehab. And that's with a lot of the injuries. When we're talking about specific protocols that you typically recommend for shoulder and elbow injuries, can you walk us through some of those details?
Yes, and thankfully, a lot of our injuries to the shoulder or elbow can be treated non-operatively, because the last thing the player wants, the last thing the team wants, the physician wants is someone to have to undergo surgery in cooperation with the physical therapists and the athletic trainers that we have, including sometimes biologic injections, a lot of the different modalities that the therapists can offer. A lot of times it's simply shut down and rest and let things heal, whether it's a stress reaction or a tendonitis or an inflammation. So again, thankfully, because the surgical rehabilitation is so lengthy, whether you're a professional athlete or a weekend pickleballer, but thankfully we can rehab them typically out of their injury without surgery.
Dr. Padley, you had shared with us in our prep interview that one of the advanced rehab techniques that your team or your patients have access to is blood flow restriction therapy. Can you tell us a little bit more about that?
Yeah, blood flow restriction it originally came from the military, which interestingly a lot of our stuff with rehab or even surgical procedures have come from military or wars in the past. And so blood flow restriction is a low pressure. Basically, if you look at it or see people on it, it looks like they have a blood pressure cuff on their extremity, whether it's their arm or their leg or their calf. And that helps reduce blood flow out of the air to help encourage healing as well. But there's a whole protocol and policies that they follow on how much is restricted, how long it's restricted. But you can even do workouts with the restriction. So blood flow restriction, or BFR commonly called, is a good modality that is getting utilized more and more in the clinic. And slightly different than like biologic treatment, which is going to be more using your own body's products, such as platelet-rich plasma, or PRP it's called, or stem cells or exozyme type treatment.
Thank you for that. So when we're talking about the post-operative recovery expectations, what should a primary care physician be? How do they set these expectations for their patients that have undergone a rotator cuff repair, or as you were sharing with us earlier, Tommy John surgery?
Right. I think the biggest thing that we can do for the patient is to, like you said, set the expectations. Like, give the realistic time frame of how long this is going to be. Rotator cuff surgery, you're talking 6 months for rehabilitation. So when we set those expectations from the get-go, then I think that helps a lot. And we tell people this is definitely a marathon, not a sprint. And even to different types of knee surgeries you do. Meniscal surgeries have come a long way over the last 5 to 10 years, where we're doing more and more meniscal repairs. And so someone will have that type of surgery and they're on crutches for 4 to 6 weeks, whereas their friend just had a meniscal surgery and they're back at pickleball in 4 weeks. So they think something, what's happening? So
did you do your rehab?
Right, yes, that's a huge part of it. But I think setting the expectations, letting them know rehab is an important part. Like, we're the technicians, we do everything the best that we can to correct things and repair things, but then the rest has to be the body taking over and healing, and then the physical therapist and the patient complying with that to get the outcome that we're all looking for.
So as you're talking about physical therapy, what do you have available for your patients that see you in clinic?
Yes, as we mentioned, we have all the imaging we can do at the very beginning of when we first see the patient. Commonly, as they get roomed, they're getting x-rayed, and we're reviewing those with the patient and reviewing advanced imaging. Obviously, we have surgical schedulers that can set up surgery if need be, but we do have in-house physical therapy, all part of the Banner Physical Therapy program. We have in-house GMEs, so we can provide bracing for them, and nutrition. We have full-time nutritionists on staff now as well, which is beneficial, because if someone has to go through the stress of being signed up for surgery, then they know they leave with everything they're going to need. The contact for the surgery scheduler, the equipment they're going to need afterwards, whether it's a sling or a brace or crutches, and then they know that we're going to follow through with them for the PT to get them back to where they want to be.
I'm a mother of 4. All of my children were in club sports or high school sports, and we saw a lot of overuse injuries with our kids. Walk us through some of these overuse injuries, and what non-surgical interventions can we as parents or as athletes or as primary care physicians listening implement and teach our patients how to navigate?
Yeah, and those are sometimes the harder conversations to have, because if you have an obvious injury, a break, a tear, something you can show them on exam as well as on their imaging, then it's pretty clear cut. This we're going to have to surgically fix. When we find things that are more overuse issues, edema or stress reaction to the bone, chronic inflammation of the tendons, tendinopathies, some of the harder conversations are, you need to shut down. You need to stop, and you need this period of rest, especially the younger athletes. Their body needs to heal and recoup. And so there's lots of good studies that show the year-round, let's say baseball, of course, the year-round player, club after club, after school, after club, after club, they can break down sooner, obviously, than the ones that are more well-rounded. Like, okay, I do baseball 4 to 5 months out of the year, but I'm also on the track team, or I'm also on this team. Those well-rounded athletes typically advance further down the road into professional sports. I mean, already when you have these players, the numbers are about 5 to 6% of the guys we have here that actually make it to the 26-man roster. So,
and when we're saying multi-sport, we're not saying you have to be a professional in these, but
correct.
Give your body the release from that repetitive motion.
Correct. You're using other parts, specifically like if it's baseball to track, and now you're a runner or you're a jumper, you're using different body parts than consistently just throwing and abusing your arm or elbow.
Right. When we're talking about your athletes, when do you identify or how do you know when that athlete is ready to return to play? Because they're going to tell you one story.
Yes, they're ready to go. So the physical therapist that's working with them, the athletic trainer that's working with them more consistently and throughout the week, we'll get information and feedback from them. And then there are some specific tests based on your injury, what they can do as far as return to play readiness. There's different tests that can be performed, different agility type activities that can be performed. And once they clear all those, and then of course we evaluate them, then typically we're ready to go back.
You had shared with us that there is some really exciting news coming to Goodyear this summer. Share with us the exciting news that Banner Health is going to be bringing.
Yes, Banner Health is expanding to the Southwest Valley a little bit more. So a medical office building is being built in Goodyear, and so it's about 5 minutes from here. And so it's exciting for me to expand our practice area out further to this region. So it'll incorporate Banner Medical Group providers, orthopedics as well. Now we'll be able to cover this area, which is very exciting to me.
That is very exciting. And so you had mentioned that there will be some Banner Medical Group physicians there as well. Can you walk us through what's envisioned for that center?
Yeah, I mean, as far as I know, the center will be more of an all-encompassing, even primary care, medical imaging, orthopedics will be there, of course, and we'll have different specialties, including hand and elbow, total joints, sports medicine, potentially spine. So it should be a very well-rounded clinic, and it'll be a beautiful building like they typically build, and be very impressive to the patient's population as well.
Dr. Padley, do you have any advice for our young athletes or our weekend warriors, or even maybe some of our majors and minors that might be listening, when we're talking about how do we maintain peak performance and really minimize that risk of injury?
Yes. I mean, I think the science shows and the literature supports that, peak performance is multifactorial. It's mental health, it's metabolic health, it's, having your body in good shape, it's nutrition, and then, of course, there's structural health. And so all of those should be incorporated to give you the performance you want and the longevity that you want. And the opportunities that have come about of what we can offer patients now, not only here, but in the general population, has been huge, and it's going to continue to get bigger and bigger, potentially even with AI and different things, how we can possibly predict some injury or prevent injury. It's going to be exciting in the next 10 to 15 years to see what else is out there.
Well, wonderful. Well, thank you so much for joining us today on Making the Rounds. This has been
Thank you for
amazing.
Coming out here. Yes.
Thank you for sharing.
Your on-site first one.
I know. This is super exciting. Thank you for joining us in this conversation about the advancing treatments in orthopedics and sports medicine. If you found this conversation as informative as we did, please subscribe to our podcast for more discussions on important medical topics. To learn more about Dr. Padley and the orthopedic specialty services available at Banner Health, please visit bannerhealth.com/orthopedics. Thank you for listening, and we'll see you next time on Making the Rounds.